Welcome to StantonMD. I'm board-certified emergency physician Dr. Ryan Stanton. Today we look into what is likely the future of a significant portion of primary care in the United States. Direct primary care is a model in which patients pay a subscription that covers nearly all aspects of care provided through a primary care physician. This physician and team take on a smaller load of patients to allow for more in-depth evaluations, attention, and 24/7 access. This model has been around for many years, often labeled as concierge medicine, but as more primary care physicians transition to this model, it's becoming accessible to those of every socioeconomic status. As the costs of healthcare spiral out of control and the insurance industry records record profits while still raising premiums to levels that are basically prohibitive for most Americans. Even if you can afford the insurance, the out-of-pocket costs and insurance gaps are growing as well. During all of this, physician burnout is at an all-time high and job satisfaction at an all-time low. Direct primary care allows patients to pay significant discounted rates for a monthly subscription because the model takes out many of those overhead costs and hidden costs in the current healthcare system. Patients are happier, physicians are happier, and it may be the future of successful U.S. primary care systems. AccessMed is a direct primary care service in Central Kentucky that provides its primary care for services at a basic $50 per month subscription rate. After talking with the providers and patients, it's becoming clear this is such an attractive consideration for all involved.
So AccessMed is the first direct primary care clinic for Central Kentucky. It was kind of birthed out of this concept of patients falling through the cracks, and as Ryan and Andy and myself worked in busy ERs, we saw it time and time again that patients just didn't have good access to their providers. We decided we would try to do something about that, so we did some research and came upon this idea of direct primary care. And what direct primary care is, in essence, is just primary care, preventative care and urgent care without any of the middlemen. We offer our services directly to patients through a subscription service. And that sounds simple enough, but in doing so, you eliminate a lot of the extra hidden costs and the hidden variables that make patient care so rushed. So instead of, your 5 minute to 7 minutes of FaceTime with your doctors, you see us for about 30 minutes to an hour. The cost is drastically reduced by decreasing overhead, cutting out a lot of the middlemen, cutting out a lot of the paperwork, so we focus on our patients, and that allows us to practice medicine in a more ethical, more transparent way. It's very patient-centered.
The key to this model is removing the hidden costs and overhead that plague the current healthcare system.
The traditional model involves, obviously, the billing of insurance, and for simplification of that process, I'll have to kind of use a scale. So your care kind of starts with, okay, this is what I recommend as your provider, and then it gets passed on to a billing company, and that gets passed on to a coding company, and that gets passed on to an insurance company. The insurance company says, we'll only pay so much of that, so you've got some inflation on this end and try to deflation on that end, and what that ends up doing is it increases the cost for the individual. For every person that touches that chart, you've got extra payments to maintain staff. If we were to run a traditional clinic, we would probably have about 7 to 9 office staff to help us focus on patients, and about 2 of them would be devoted to patient care. The rest of them would be devoted to charting, answering phone calls, calling insurance companies. So we eliminate all that and really focus on the individual.
So this was born out of our ER experience. So Jeremy and Ryan and I have all been ER providers in the past. I've been primary care provider in the past. And so these kind of services are born out of our experience in outside services. I think we're all trained as providers to provide these kind of services, and because of time constraints, a lot of times those services are kind of constrained, and the amount of services that are referred out to specialists are a whole bunch. So we're trying to get back to the primary care, the family doctor or family provider providing most services that you would need except for the super specialized surgical type things. So that's kind of our niche, I think. So this model kind of eliminates the need for an urgent treatment clinic. You have 24/7 access to your provider with texts and phone calls and emails 24 hours a day. So the walk-in clinics, the need for those with our model are essentially eliminated. Most need for ER visits are eliminated except for in the most dire circumstances.
This direct primary care model allows the providers to charge actual streamlined cost, not get bogged down with burdensome regulations, and takes out the least cost-effective aspect of medicine, the insurance.
Direct primary care should be affordable for essentially everyone. If people can afford a cell phone bill, they can afford a subscription to a direct primary care practice. Our practice average is about $50 a month, so most people can afford that for their entire family, each individual. So it's not just for the 1%, it's for everyone, the middle class and down. There are people that have Medicare that subscribe to our practice as well, in addition to their Medicare supplements and things like that. With the rising costs of insurance and more premiums getting higher and higher, actually our option is becoming one of the more cost-effective options in the insurance world. So we like to use an analogy of car insurance and make that comparable to health insurance. So you don't buy your car insurance to change your tires and change your oil. You buy your car insurance in case you get in a large accident. We think health insurance should be similar. You don't need your health insurance to see your family doctor. You don't need your health insurance to do routine lab work or some routine testing or routine procedures. You need it for major surgeries, cancers, those kind of things, trauma. That's when you need your health insurance. So our model really eliminates about 80% of all insurance claims. So insurance generally should never be involved in our kind of care. And yet, even with that, the personal costs will be exponentially lower.
What many don't realize that is the current healthcare system, it is built like a layer cake, but each layer is rules, distractions, and cost. Thus, every dollar we spend on healthcare only returns a fraction in change towards our care and those that provide that care.
That patients actually have better outcomes. It's pretty neat. For instance, you're about 65% less likely to be hospitalized in a given year. It was a study out of the British Medical Journal. And 82% less likely to require surgery in a given year. And the reason for that is really simple. If you have good access to your provider, if the provider has the time to listen to you and is attentive, and if you're not worried about, okay, if I go back in to talk about this, I'm going to have to pay another bill that's not going to apply toward my deductible. You don't have to worry about that financial constraint, which all translates to giving patients better access, more availability, and listening better to the questions and focusing on preventative care. Again, we always talk about a goal of trying to improve patients' wellness and their overall health as opposed to just prescribing another medication. The main one is you get better care and better quality. It has nothing to do with the providers per se and direct care versus a traditional setting. It really has to do with the time, the availability. So the average wait time to get into a doctor across the United States for a sick visit is about 21.5 days. It's a long time to wait if you're sick. With the direct care model, you get in the same day or the next day. You have 24-hour access to your provider. So if something comes up in the middle of the night and you're concerned, you're not sure if it's emergency room worthy or if you should stay home, you just call us and we can kind of steer you in the right direction. Some of the other benefits are the cost. So the average cost is about $50 a month. That's no copays. It's office bedside procedures included. We also purchase medications wholesale and dispense them right here in the clinic. So that's generally a savings of 40+% off of retail prices on even generic medications. We always tell people, we're better than the $4 prescription plan by far for most people. We do the same thing with wholesale labs. So we draw the labs right here. We've partnered with companies, well-reputed companies around the United States for cash-based prices on labs. So your retail price on a simple complete blood cell count, or a CBC, is anywhere from $24 to $40. Our price is about $1.65. So there's a lot of overhead that we don't have to worry about, and we can essentially write off and pass that savings on to our patients.
So in addition to the 24-hour availability and the same-day, next-day appointments, we also have in-house procedures, including laceration repair. We do some bedside ultrasounding. We do some splinting for broken bones before referral to orthopedics. Multiple other procedures. We can lesion excisions, multiple procedures we can do in the office, and those are all included in the subscription package.
The Access Med Clinic, as well as most direct primary care offices, provide the services of a family doctor, basic bedside procedures, discounted prescriptions, allergy testing, negotiated imaging rates, and access to the most cost-effective referral network. Coming up, we talk with patients about how direct primary care changed their approach to health care. More StantonMD coming up. Stay right there.
As a board-certified emergency physician, Dr. Stanton is a proud member of the American College of Emergency Physicians, also known as ACEP. ACEP provides physician and evidence-based patient resources at its consumer website, emergencycare4u.org. That site has stories, fact sheets, and advice on a wide range of emergency topics. From visiting the ER to mom tips, you can find them on emergencycare4u.org. Do you own or work for a business that advances health and safety of the public or its employees? Then you may be interested in becoming a sponsor of StantonMD. There are various opportunities for sponsorship, from the show to the website, social media, print, or a combination. For more information on becoming part of StantonMD, contact Jen at info@stantonmd.com. That's info@stantonmd.com. Now, back to the show.
Welcome back to StantonMD. We have talked with the providers of direct primary care through Access Med, but what does it mean for the patients?
When the Affordable Care Act went into place, insurance became unaffordable for my family. So at that point, my family was without insurance basically for 1 year. Continued looking around for different options as to what we might be able to afford, and through word of mouth I heard about Access Med and looked into their model, looked at their pricing structure, things of that nature, and went to speak to them and found their model would work perfectly for us, at least for a primary care physician for the family.
It became clear that a big niche for direct primary care is the self-employed and small business owners, a group that is left behind in current legislation as costs skyrocket and they don't have the luxury of larger group negotiating powers with the insurance companies.
In our business, if we're sick and we can't work, we don't make money. It requires us both to be healthy. So this is a preemptive form of medical care. They try to keep you well. They don't just treat sickness, and that really matters with our business. Something else that we really liked as individuals, not just as business owners, is the way they handled our preferences. They don't dictate to us what needs to happen. They say, here are your options. And when I said, there was one time I went in and I was talking with Jeremy and I said, I'm not interested in taking these kind of medications. I don't like medication. I don't want to do this. And they didn't argue with me. They said, okay, if that's completely off the table, then these are our options. And they didn't blink. They went with what I believed in and worked with me to get the best care.
It certainly, I think from a business standpoint, it enables us more time to conduct our business because we don't have to worry about keeping up with insurance payments. We don't have to worry about co-pays, that sort of thing. It's all handled with our monthly subscription. And on our end, it's less paperwork. I know it's less paperwork on their end, but on our end as patients, it's less paperwork, less things to have to keep up with. Gives us more time to conduct our business when we do have to go in and see the folks at Access Med.
It is so cheap compared to what we have had to pay in the past, especially if you try to get it for a small business or you try to get it as an independent and individual. It is prohibitive. Yeah, if you don't have a group plan, you're not going to be able to afford it. At least we couldn't. What we do now means that we have access whenever we want it, and it is, I smile when I write this check. I seldom smile when I make out the bills, but I always smile when I make out this check, because I know that no matter what happens, we're covered.
The cost that you incur through direct primary care is so much less than what it is through traditional insurance-based care. It's amazing. You get such an incredibly high level of care for a much lower price, and that's the...
It's not just the care, it's also the prescriptions, it's the lab work.
Yes, that's right.
I mean, what you had been paying, what, $30 or $40 a month for on one of your prescriptions is 78 cents with
Yeah.
Access Med?
I just laughed the first time they told me how much
We thought they were joking.
my prescription was. We did. We thought they were joking because it was so low.
It's so low at this point that I just pay it, every 2 to 3 months, because it's not worth paying it, whenever he picks it up.
Much cheaper than traditional pharmacy services and other care. You get your lab work, much of it done right there, other testing services done right there in-house. And for the services like x-rays and things that they can't provide in-house, they work with you to help find the cheapest provider for those.
With the best service.
Diagnostic tests as well.
Yeah.
So.
And they did that for us when we had to go in and get, was it x-rays?
Mm-hmm, those x-rays.
Yeah, they helped us to find the best place here in Lexington, so that we could get a decent price on the extended work that we needed done.
And then it ended up being hundreds of dollars cheaper than what we were going to be able to get locally. And it was worth the drive to Lexington, 30-minute drive for that. Saved hundreds of dollars.
It's a similar story and need for the self-employed like Justin Morrell.
When the direct care model came around, it was a much cheaper solution, and I've had better health care, cheaper, more access to my doctors, and just overall, better everything. With traditional insurance, I was paying almost $400 a month just to cover myself. Here at Access Med, I pay almost a tenth of that. I have better health care. I still carry catastrophic insurance, which is what insurance is for. Is, when a major event happens that's just outside of the realm of your budget. But for my general everyday care or little things that I could get taken care of just by seeing the doctor whenever I needed to see the doctor, direct care, the direct care model is far superior than the insurance model that we currently have in the United States today.
I heard over and over about the affordability compared to health insurance, but patients also talk about the comfort of access and how direct primary care can save everyone money by keeping patients healthy, out of acute care settings and out of the hospital.
It is phenomenal. Back a year ago, I think it was last year that you got sick, Steve got pneumonia. He got the flu that went into pneumonia, and if it hadn't been for Jeremy, he would have been in the hospital. Jeremy actually made house calls and called me and texted me and was available to me 24/7 to monitor him and make sure that he was progressing properly. Otherwise, he would have been in the ER and he would have been in the hospital. But Jeremy kept him out of the hospital and got him well. And really good time, considering how sick you were.
It did. Access Med seems to be so responsive to our needs. They respond via phone calls. They also respond via text.
Email.
They're there for us anytime, night or day, that we need them. And like Angela said, they have actually made house calls. Where in the world do you see people, doctors making house calls this day and age? So it's just a fantastic level of care that they are able to provide that you don't get from any other type of physician services, at least in my experience.
It's a great feeling. Prime example, this past weekend, we were out camping. My son, stung by a wasp or some type of insect, had a severe reaction. And instead of having to go to an ER room, urgent treatment, anything like that, I was able to get on the phone, contact our doctor directly, speak with him. He told me exactly what to do, sending pictures. He was able to look and tell pretty much what it was, what had happened, what's going on. And he stayed with us throughout the whole weekend just by phone. and told us what to do to care for him during that need. It was so much easier, so much more convenient, and the advice, of course, worked. I mean, he's now feeling much better. The symptoms are going away just by following their advice. But that access to him was vital. Instead of having to leave our campsite that we were at to go spend a fortune at a hospital or urgent care, I was able to talk to our doctor just right then.
Coming up, we talk with a Kentucky state senator who sees direct primary care as the future of access for many and a way to save the future of U.S. healthcare. More StantonMD coming up. Stay with us.
As a board-certified emergency physician, Dr. Stanton is a proud member of the American College of Emergency Physicians, also known as ACEP. ACEP provides physician and evidence-based patient resources at its consumer website, emergencycare4u.org. That site has stories, fact sheets, and advice on a wide range of emergency topics. From visiting the ER to mom tips, you can find them on emergencycare4u.org. Do you own or work for a business that advances health and safety of the public or its employees? Then you may be interested in becoming a sponsor of StantonMD. There are various opportunities for sponsorship, from the show to the website, social media, print, or a combination. For more information on becoming part of StantonMD, contact Jen at info@stantonmd.com. That's info@stantonmd.com. Now, back to the show.
Welcome back to StantonMD. We all know that much of healthcare is driven by politics and politicians. We sat down with Dr. Ralph Alvarado to talk about politics and direct primary care.
Yeah, I'm a physician, do internal medicine and pediatrics, and I'm also serving the state senate here in Kentucky.
Dr. Alvarado has a rare viewpoint in politics with regard to healthcare, as someone who sees it from both sides. As a politician, he sees the complexities of the healthcare legislation, and as a primary care physician, he also sees the challenges from the viewpoint of the patients and providers. Dr. Alvarado has been a big proponent of direct primary care and has spent the last couple of years helping educate politicians on the model and why it's a great opportunity for patients across all incomes.
So direct primary care essentially is we've come full circle in medicine. We're going back to where we started from, and I think people are finding that the current system we have is very unsatisfactory, not only for patient experiences, but also really for physicians, and we're getting a lot of physician burnout. Doctors are finding themselves becoming data entry experts instead of being doctors and using their skills to treat patients. And so physicians spend more time looking at computers than they do at their patients, and they're finding it frustrating. I think you find less people going into primary care and more of them that are in primary care dropping out and finding other means of providing services. Direct primary care, I think, is going to get us back to the roots of what medicine was about, letting doctors be doctors. I think that the doctors sometimes are earning a little bit less money doing this, but have smiles again, are enjoying their jobs. And because of that, patients who are participating with direct primary care are having a much better experience. They have doctors who are more engaged, more interested, spending more time talking to them and dealing with their issues and problems. You have to remember that what medical insurance is, it's insurance. It's what it's supposed to be. So like if you have auto insurance, again, you don't go to your auto insurance company and say, hey, I need you to pay for my oil change, or you need to replace my tires because if they go bad and the car crashes, it's going to be on you to cover that cost. You pay for that maintenance, and direct primary care, predominantly for primary care, is going to be a maintenance type of thing for your own health. And then people need to start getting incorporated a bit more with personal responsibility for their own health care. This allows that interaction to occur. It lets people kind of cover their own maintenance of their health, and then if something catastrophic does occur, that's when insurance can kick in. As we curb those costs down away, I think we'll see insurance costs come down as a result. And make it much more affordable for people to get. But we don't want to treat health insurance we want to treat it as an insurance and not as a health plan. I think that's where we've gone awry as a country, is we expect our insurance to cover everything when it comes to our health. And I think a DPC model is going to work a lot better, and it cuts out a lot of the bureaucracy, lets doctors be doctors again, and lets patients enjoy that relationship.
Dr. Alvarado sees the potential for significant taxpayer cost savings through wellness and prevention.
If we're able to just prevent one hospitalization at that $5,000 mark, just one, we've paid for a direct primary care physician for the entire year. And so we're going to save quite a bit of money. And we're talking about patients who are hospitalized over and over again, or they're in the emergency room over and over again. Allowing a doctor to have that one-on-one interaction without all the burdens of the insurance companies and government oversight, I think is going to make a huge difference.
Many people, when they hear about direct primary care and concierge medicine, assume it's only an option for the upper class. The patients we talked with earlier don't see this as the case and see it as a true quality access at a bargain rate.
Sounds great.
Dr. Alvarado also sees an adaptation of this model as an option for the other populations as well.
Because they have Medicaid, can't find a physician, they can't find a doctor. They have huge deductibles even if they did, and they can't pay those deductibles for those patients, for those doctors anyway. So what a lot of these patients will do is they'll hire a direct primary care physician at $50 a month, and they'll see them 3-4 times a year, have their routine labs drawn, and they can afford that payment, but they can't afford the deductibles that have to come in. And right now, the current system through insurance is that doctors are incentivized to see those patients over and over again to submit a bill. But people that have high deductibles will wind up having to pay those out of pocket, and if they can't afford it, then they're in trouble financially with a medical practice, and they lose their primary care provider. So I think that a lot of our working poor have taken advantage of this. They use the system well, and they know that if they get hospitalized or some catastrophe occurs, then their Medicaid will kick in. So they're using their Medicaid insurance as a means of a catastrophic insurance, and then using a direct primary care model, which gives them a lot more attention from a doctor without all the headaches of having to deal with Medicaid. And I think we can use what works for the wealthy to use for the people that are also are poor, that are in Medicaid or are medically frail, who can't find providers. We can use that same model and let the state experiment and try that with people. And I think we're hoping to get that into the budget this next year, but hoping to find tremendous savings by applying that same model for people that are the poorest of our system, that are having to use the ER, overutilize the system now.
As we look for solutions to the growing healthcare crisis, direct primary care seems to be a win-win for patients and their providers. These clinics and opportunities are growing throughout the United States and are definitely worth a consideration if your access and costs are prohibitive to your health care. I encourage you to look further into the options in your region and see if direct primary care is a good fit for your needs. If you're in the Central Kentucky area, Access Med has clinics in Danville and Lexington. They're happy to answer your questions about this evolving healthcare model. That's all the time we have for this episode of StantonMD. Thank you for tuning in. You can catch prior segments and episodes on the StantonMD.com page and our YouTube channel. Subscribe to the YouTube channel so you can keep up with every episode of the show as well as the segments. You can also join the conversation on social media, like our Facebook page and follow along at EverydayMed on Twitter. Until next time, I'm Dr. Ryan Stanton, and this is StantonMD.